Thursday. He donated all day Friday. I actually think he went a little late, but nevertheless, he worked just about a whole day at a free clinic once a week. And we have some doctors doing that here at Matthew 25, and we have some folks doing that. But that is not a solution. That's a stopgap measure that treats some people, sometimes, some ways. It's not an answer. It's just some people doing the best they can with what they've got in a particular situation. If we have to rely, that's like repairing a car with chewing gum and duct tape. It may get you to the next service station, but it's not the way you want to start a trip to Florida. And that's our healthcare system. It's overpriced, under-rationalized, or it's not reasonable. I mean by ration, not ration limiting the amount, but rational in the sense of sensible, reasonable. Those kinds of issues are moral issues in our understanding of religion and church and moral values. To be completely irrational is a moral failure when that irrationality affects others. If you want to go run around in December with a t-shirt on occasionally, okay, that's pretty irrational, but that's not necessarily a moral problem. If you, however, forbid people from getting anything but t-shirts to wear in the winter, that's a moral problem. And that's where we are with healthcare. We're forbidding about a third of the people from getting anything like reasonable health care. And we're forbidding it under the great economic lie that, well, they can't afford it, they'll go out and work to make enough money so they can afford it. This is like saying my dog is going to start doing trigonometry tomorrow. That's not a feasible expectation of all people at all times. Any kind of sensible government recognizes that this is not the perfect world. The end has not come, and we are not living in the rapture. And so we either care for people or we don't care for them. It's just, the moral issue is simply that. We either care for the people who can't care for themselves without asking why, because it doesn't help us. We don't need to know why someone has fallen on the side of the road and is bleeding. And the religious leader and the secular leader have walked by. And we're a foreigner. And we see the guy on the street bleeding. We stop and pick him up and carry him to the hospital and leave a deposit for him to be taken care of. You all know the Good Samaritan. This isn't complicated stuff. This is not new. It's not unchristian. It's not irreligious, communism or something. This is compassion. This is care. This is the root of all religion. We don't care for one another. All this, all the foolishness we do is just hot air. We don't care for one another. And right now in our nation, the greatest compassion issue, which we can address most directly and most straightforwardly, is health care. In some ways, we have far more power to affect the healthcare system than we do militarism and foreign issues.
What are the obstacles?
The obstacles. Well, the obstacles are, I think, fairly straightforward. Clearly, the entrenched interest of people already making tons of money on the system is a major problem. That we've addressed over the last 10 years in some ways. The American Medical Association, which has been the lead opponent in all forms of health care up until the mid-90s, has now pretty much reversed itself and advocates some form of rational national health planning. It still has a lot of caveats to protect its high income. Doctors are getting more and more jealous of business people who have chances to make great deals more money than they do. that may be the second biggest moral problem in our country, the high cost of executive salaries. Again, something we can address most directly and most straightforwardly, and which is on moral grounds and in a sort of straightforward rational thing. Again, something internal and therefore dramatically more addressable than something external, like the Palestinian-Israeli war. We're not Palestinians or Israelis, but we are Americans, and we can at least affect that. I think that the greed and jealousy of the medical establishment has been the primary thing, but that is beginning to break down. The insurance companies remain the second biggest organized bloc, and they are huge. Someone said to me once that there were 8 insurance lobbyists for every single person in Congress.
I believe it.
And I think that someone was my father. He has been known to exaggerate on occasion, but he read that somewhere. He's a great fan of the news shows on the major networks and CNN and MSNBC and those kinds of things. And he collects all of these things and they float around in his head. And I am my father's son. I collect this sort of stuff too, no matter how hard I try to focus. It's really important for us to understand that Germany took their insurance companies and made them the providers in their national health plan, so that in each major German province, state, there's 3 or 4 health insurance providers that are independent insurance agencies. However, they all work under standardized rules, and they are pass-through, not a determinant. They pass through the decisions. They don't decide whether you get the insurance or not. You get the insurance or not based on the law of the state, which are basically organized in a national plan. But the money is transferred from the state to the individual through the insurance companies. This is the plan the Germans used in order not to put a whole ton of people out of business in the 50s, when everybody who had a job needed a job. In fact, more people that had jobs needed jobs, and that was the German solution. Insurance companies are a big part of the huge cost of our health insurance plan, and I'm not so sure that a single-payer system isn't a better solution. But as I say, if it took 25 years of multi-payer system to get to a single-payer system, I could live with that. I mean, I live with Social Security, and it's as irrational a plan as anyone ever devised. It has more loopholes in it than, a box of Cheerios, but it's still a system that works better than anything else we've had around here, and could be the basis of gradually increasing health plan. I'm also personally not opposed to adding children under 5 in the next 4 years, and children under 12 the next 4 years, and children under 21 the next 4 years, and everybody else 4 years after that. I don't need perfection today. I've never been one of those, we need to get it right the first time. Because I have this sense of human beings, they've never gotten it right the first time. And I'm not expecting to get this right the first time either.
What about children? You used the figure 1/3. That's higher than the figures I've heard. Plus, we have CHIP and these other programs that have been put in place the last few years aimed at children. Is it really the case that makes children?
The national figures is around 30%. CHIP and several other programs are what you have to use to get below that. But again, CHIP is not universal. It's not applied equally, and it has no preventative care at all. Zero, zip, nada, nothing. So it is an emergency system of last repair, but they don't proactively enroll you. If you're poor, you have to go enroll in the program before your child gets sick. Now, if you're poor, that's a big burden. And that's again, the problem, this is the problem with so much of our federal agency